Hi, I'm Dr. Giordano, physician and owner at Carolina Age Management Institute, where we perform FUE, follicular unit extraction hair transplantation. We've been doing this procedure since 2013. We have a very professional team that does both manual and robotic FUE. We provide services that give the best results of hair transplantation in the entire country. We are also the only practice in the Carolinas that has both neograft and ARTIS robotic restoration. In this video, we'd like to talk to you about what FUE actually is, what to expect before the procedure, during the procedure, and after the procedure. FUE is a procedure that was invented not long ago that has really essentially replaced the strip method, where they used to cut the back of the head and leave you with a pretty big scar from side to side. With FUE, that no longer exists. You have no scar, no linear scarring in the back of your head, and you recover in as little as 1 week. Each hair follicle is removed one at a time from the back of the head and placed in the area where you're balding, making it look very natural and imperceptible that you had anything done. Preparation for an FUE case is pretty simple. It revolves around getting a haircut prior to coming in. We can always cut your hair for you, but we recommend a professional do this first. Washing your hair with Hibiclens before the procedure, not the day of, and expecting to spend about 5 to 7 hours with us that day, depending on the size of your case. We recommend avoiding any aspirin or blood thinners before the procedure. We also recommend smoking cessation at least 1 to 2 weeks prior to the procedure, as it will affect the healing time. We also recommend that you do not color your hair 1 week prior to the procedure. Also, in your pre-op consultation, medications will be prescribed to you for the day of the procedure. Please remember to bring those with you on the day of your hair transplant. Because of the need to medicate you for the case to ensure your comfort and relaxation, we recommend that you have a driver to take you home. You will not be able to drive yourself home. Please go ahead and eat a good breakfast prior to coming in. Please wear a very comfortable shirt, something that you don't care if it gets a little dirty or a little stained. And also bring some music or books or an iPad while you have your procedure done to entertain yourself. Now I'd like to talk to you a little bit about the day of the procedure. You'll arrive somewhere between 7:30 and 8:30 in the morning. If you choose not to get your hair cut prior, we will go ahead and cut your hair, and we will draw a hairline in the front of your head or on your crown that we both agree on is what your expectation is. After that, you'll undergo a series of nerve blocks to ensure that you're completely numb before we start the procedure. Again, this can all be done with local anesthetic and oral medications. There's no need to go to sleep for this procedure, which increases its safety profile. After the nerve blocks are complete, our team will go ahead and start extracting the follicles, usually from the back of the head, because those are balding resistant hairs. That will take about 3 to 4 hours in the morning session, at which time we will then break for lunch and feed you. In the afternoon session, we will again do some nerve blocks in the front here and place all of the follicles very artistically into the front of the scalp. And by artistically, what we mean is matching the grain of your current existing hair. We will also make sure that we put the little tiny miniaturized hairs up front and then fill in with the thicker hairs, just like Mother Nature does. This is a very artistic process, and we pride ourselves on having one of the best teams in the country to do this procedure for you. The overall procedure will probably take anywhere between 5 hours up to 8 hours, depending on the size of your case. The average range of follicles done is somewhere between 1,500 to 2,500 follicles, with a maximum follicle count of about 3,000 follicles per day, which would be a pretty large case and a pretty long day. If you desire more follicles than that, or you need more follicles than that, we usually split the procedure into 2 different cases. Let's talk about post-FUE hair transplant instructions. Most people have the most questions about the first 24 hours after the procedure and what to expect. In general, most people will be pretty groggy and sleep the initial night after the procedure. The next morning, a lot of questions are asked about swelling, pain, and what can they do to shower. The pain is minimal. As somebody who's had the procedure themselves, I can tell you that a lot of people can manage this with minimal medications, such as Tylenol. If you need stronger medications, it is provided for you. The first question that people ask us is about sleeping. Very simply stated, the best way to sleep is in a recliner for the first 2 to 3 days. This elevates the head at 45 degrees, thus reducing the swelling, and it also prevents you from rolling around from side to side, which could potentially damage your newly transplanted follicles. Patients will have a bandage across the back of their head where the follicles are harvested. There may be some slight oozing from this area. That is not abnormal, and it's nothing to worry about. Usually the back of the head heals in 4 to 5 days, and it is largely undetectable that a procedure was even done. In the front of the head where the follicles are transplanted, most patients will notice some minor scabbing in that area, which will take about 2 weeks to clear. If you have some existing hair where we transplant it, it's very easily camouflaged. If you are completely bald in the area that the hair is transplanted, you will likely notice the scabs for approximately 2 weeks. The next hot topic that most patients talk about is showering. This is something that I want to go over in some detail. So for the first 2 to 3 days, you will only shower from the neck down. So from here down. No water, no shower, nothing should touch you from the neck up for the first 2 to 3 days. After that time, we will explain to you a technique that you can use in the shower to prevent any damage to your newly transplanted follicles. So after the first 2 to 3 days, when you're in the shower, we will provide you with a red Solo cup that you put a little Johnson & Johnson baby shampoo in, and you shake it vigorously to get it very soapy. At that time, you can dump that over your head 2 times only. And then you will take that same cup, fill it with water from the shower head, and dump it over your head 2 more times. And this is how you will clean the top of your head for the next 2 weeks. You will not put direct shower pressure onto your head or any other gentle massage for 2 weeks after this procedure. Please avoid any scratching, massaging, or direct contact to the follicles in the first 2 weeks. This may result in some of the follicles coming out and getting a less than desirable result. Another point I would like to emphasize is please do not use any type of shampoo other than Johnson & Johnson baby shampoo. We don't want any chemicals, perfumes, or anything else to harm the newly transplanted follicles. At the 2-week mark, we are okay with you then starting to gently massage the area and allowing the shower to hit the top of the head. It is safe at that time to take the Johnson & Johnson baby shampoo, gentle circular massage in the area to loosen the scabs, and then let the water run over that area for a minute or 2. At this point in time, your follicles are pretty well rooted and stable. You can get away with doing a little bit more after 2 weeks, but we still want you to take it easy for up to 6 weeks, meaning no direct sunlight to the area. If you need to go outside, we recommend wearing a hat that will not touch directly on the follicles. At about 6 weeks to 2 months, unfortunately, the follicles are going to fall out. It's at this point that most patients feel like the procedure didn't work. That is not the case. This is completely normal for this to happen. All of the follicles will initially grow for about 2 to 6 weeks, and then they will shed. They will go into a resting phase for several months, and around 5 to 7 months, all of these follicles will grow back, and when they do, they will grow back permanently. This is a permanent correction to balding. You will have these follicles for the rest of your life. We would like to see you somewhere around a month after the procedure, and then again about 6 months after the procedure to document your journey and to make sure that everything is going as planned. A lot of people ask, am I a candidate for this procedure? During the pre-op consultation, we will guide you through this process and tell you very frankly if you're a good candidate or not. The last thing we would want to do is do a procedure on somebody who is not a good candidate. Our professional team has plenty of experience nationally at determining who is a great candidate and who is not. This procedure is most commonly done in males. However, females can be candidates for this procedure as well. If you are thinking about getting a hair transplantation, please look us up on our website and give us a call. We will set you up with a free consultation with a hair transplant specialist.